So I thought it would be helpful to give you a little bit of a preview of, or a little bit of a health timeline, if this works effectively. So basically, the history of food, Hippocrates, everybody knows about, let food be thy medicine. And that was in BC times. And then Thomas Edison has a great quote, the doctor of the future will give no medicine, but will interest her or his patients in the care of the human frame, in a proper diet, and the cause and prevention of disease. So that was in the 1800s, and it sounds a lot like what people in Rock Health do. But then there were a couple things that have happened. In 1922 is the Grain Futures Act. It was the launch of big food, in a sense. It was the first big subsidies for corn. And then the AMA created CPT codes in 1966, which was part of the beginning of big medicine. And it was about reimbursing surgical procedures and treating disease, and took doctors away from what Hippocrates talked about to some extent. So saving the best stuff for later. But in recent times, the American Heart Association called healthy food subsidies one of only two things besides tobacco taxes that actually works and improves public health of the interventions in the last coming years. And the Mediterranean diet was shown to reduce death from cardiovascular disease by 30% in a randomized control study of 7,000 people, proving what Hippocrates said before Christ. So this panel is I'm really excited to have both Larry and Aaron here because they bring two different perspectives. Larry being the CEO of the Partnership for a Healthy America, which for those that don't know is tied to Let's Move, Michelle Obama's initiative, and really taking a national view on how to engage all of business to change our culture around healthy eating and living. And Aaron taking a very different perspective at Google, trying to think about how people can be healthy. So I wanted to kick off and ask Larry first. Well, with the Partnership for Health America, how have you started to lay the groundwork for having the work that's been done with Let's Move actually live on beyond Michelle Obama's time in the White House?
First of all, I just want to say that the last panel was really fabulous, and it's really refreshing for me as a Washington, D.C. guy to come here and hear about all these ideas and innovations, and I'm very optimistic leaving this conference today. So congratulations to all of you for the work that you all are doing. I'm engaged in the fight against childhood obesity. As you heard, we're facing a crisis in this space. 1 in 3 kids are overweight or obese. 1 in 3 kids born in the year 2000 are going to develop diabetes in their lifetime. So we are looking at a future, if we don't get our arms around this, of diabetes, cancer, and heart disease, not to mention the impact on families, society, the economy. Those of you who are employers, your workforce is going to look very different in the future. Some really, really major problems. I'd say 5 years ago, if you looked at this issue, we'd all be just sort of grousing about it, worried about it, not sure what we're going to do about it. 2 years ago, maybe feel a little more optimistic because you see the First Lady talking about this, people paying more attention, some things are beginning to really happen and accelerate. And this week, I think more optimistic than I've ever been, seeing the first proof points that were published by the CDC that showed that in 19 states for the first time, we saw a decrease in childhood obesity amongst 2 to 4-year-old preschoolers for the first time. And those are low-income preschoolers, which has been really the most difficult place for us to fight this effort. So I'm very bullish about it. So the long term is going to be critical. It's taken us decades to get to the place where we are, which is kind of a mess. And we're not going to get in this overnight. And that's why my organization was created, because we had this opportunity, which I really felt was a once-in-a-lifetime opportunity of one of the most popular people in America, Michelle Obama, really talking about this issue and bringing the awareness to American families who can take action and think about it. But we were only going to have her for 4 or 8 years. And so being able to capture that energy and take it for the time it's going to be needed to fully reverse this issue is kind of what we're all about. So our organization works with the private sector to help them come up and develop changes to their goods or the services that they sell so that as Americans are now beginning to think more about this issue, they can actually take action, and the healthy choice can truly become the easy choice. So we currently, over the last, I was first employee at my organization, so I know what it's like to run a startup organization like many of you. Remind me not to do that again. No, it's been really a lot of fun. We have 60 deals that we've done, ranging from Walmart reformulating their food to reduce calories and sodium, and lowering the prices of the better-for-you versions of food to match the less better-for-you versions, so wheat pasta, same price as white pasta, to Nike and Reebok, investing $80 million over the next 5 years into physical activity programming, to GE Healthcare, changing their electronic health records programs to be more helpful to physicians and families who are dealing with childhood obesity or facing it, and so on. And so we're going to be working with those companies in the long run to fully implement those issues, and then continue to work this process and bring people together as we do over the long term, so we can fully finish this out.
Thanks, Larry. From a very different perspective, Aaron, you actually used to work at the World Health Organization, but then you switched over to Google, and you see it as a public health opportunity. But a lot of people here probably think of people that work at places like Google as already being pretty healthy. So why do you need healthy foods programming at a place like Google?
Yeah, great question. So the impetus for developing a group very recently within Google that focuses primarily on people health was largely the same as what you all are doing at the national level. And as a company where we are in a somewhat great position to have a fairly young and healthy workforce, but when you look at the bigger picture and you say, well, our attrition rates are very low, the employees that are with us today are going to be with us in 10, 15 years from now, and that we're going to be responsible for paying for those costs and paying for potential losses and productivity and innovation and things like that come from poor health. The picture is a little bit more grim than saying, yes, we're a young and healthy company now, and we expect to be that way forever. And so with all of those sort of considerations, the next question is, do we currently believe that we are providing a preventive care benefit, shall we call it, that we expect to prevent disease in the future? And no matter who you ask, in this room, at Google, the answer is resoundingly no, that a visit a year, an annual exam, these sorts of health benefits that we provide we do not believe will necessarily prevent chronic disease in the future. So then when you step back and say, okay, how do we actually start to make progress on that problem? Food comes to the forefront. It's those everyday health behaviors, tobacco, food, movement, stress and sleep, that really become very important for us to invest in as a company. And that's what we're starting to work on now.
Thank you. Larry, obviously this is a group that is really passionate about bringing technology to help solve some of the challenges we have around health, child obesity, and food as well. And you guys created something called the End Child Obesity Innovation Challenge recently, and you picked a company called Jive Health, founded by Dennis Ai. Can you talk a little bit about that program and why you chose Jive Health?
Yeah, so I mentioned I was 2.5 years ago by myself in the office and started building this team, and we were inundated with people coming to see us, companies that were the largest companies in the world and tiny startups. And just based on our resources, we really weren't able to spend much time and do much work with the smaller companies, because it takes as much time to work with them as the large ones on the deals that we're constructing. And that was a frustration to me. And I started to build my team. We commented to each other that we kind of fall in love every day with these ideas that are coming to us, and we don't have the ability to help them. And so we came up with this idea of the End Childhood Obesity Innovation Challenge as a way to try to help recognize some of these really interesting ideas that were coming to us and provide them some of the exposure that an organization can provide and some of the national recognition and attention. And so what we did was we challenged kind of America to come up to share with us their ideas. They didn't have to be fully baked. In some cases they were further along, other cases they were earlier. And then we had a America Votes sort of competition. We had tens of thousands of people vote for who they thought had the best idea with the most promise. We narrowed it down to the 3 top voters, and we do a summit every year in March where we bring together about 1,000 key opinion leaders in the childhood obesity, health, and wellness space from big companies, government, academia, nonprofit, et cetera. And we had a panel of expert judges, which are entrepreneurs and business leaders that led the assessment of those folks. And Dennis's idea won, and he won a whole bunch of different things with that to help him make this idea a reality. But what Dennis was doing is he's basically coming up with a game that made it fun for kids to eat healthy. And he's, I think, was about 22 years old, and had really thought through, I think, a way to come up with something that was scalable, fun, interesting, and would really catch on. And the judges agreed, and I think the rest is history. So you can read about Dennis's idea. So that's something that we're hoping to do again next March. So anyone out here with some good ideas, I know there are a lot. Hopefully you'll participate in the challenge.
Sounds like a rock health company in the waiting. So speaking of rock health, Zipongo, a company that I founded and I'm the CEO of, was a rock health company, and they were awesome, if anybody's thinking about it. And I actually met Aaron and Google through Rock Health. And we formed a relationship with them because they have this really interesting innovation arm of benefits called the Benefits Accelerator. And we've had an amazing experience working at Google. Can you talk a little bit about how you think about picking companies in the Benefits Accelerator and why Zipongo was chosen as a company to help address your healthy foods issues?
Yeah, absolutely. So quick background on the Benefits Accelerator. So continuing a little bit from the challenges that I laid out about disease prevention, we started looking as a benefits sort of team and a group that was working on health and wellness within the company at the market to see what interventions, public health interventions primarily, could we put in place as a company that would prevent future disease, right? And so we found that there were a lot of sort of incentive-based programs or points-based programs or frequent flyer miles type programs, and we weren't necessarily kind of satisfied with what the market was bringing us. Either that or we didn't quite have the confidence that the interventions that were being brought to us were really user-centric and designed for users rather than for HR professionals, or they didn't have the evidence behind them. So what we decided to do was to start sort of a pilot incubation program within the benefits team called the Benefits Accelerator. And the idea was to work in partnership with groups like Rock Health to find emerging companies that were trying to figure out how to design very user-centered solutions that would prevent disease in the future. And we sort of dipped a toe into like, let's see how this works. And maybe we can start by figuring out the user experience with 10 Googlers. And then we can expand it to 100 Googlers, then maybe in a phase which we really do statistically significant results with thousands of Googlers and potentially their families as well. And then if things are working at that stage and we can make it through that phase, we'll scale to the rest of the US and potentially to Google around the world. Zipongo came to the forefront because we were starting to make more significant investments in biomarker screening, and that's not an unusual thing for a company to do. To say, okay, get your cholesterol checked and your fasting blood glucose and get all these measurements, and that's useful for us as a company to see what our underlying health risks are. We also believe that it's useful for the individual to see what their underlying health risks are. It's a very valuable piece of information that you can provide to an individual. But then the question is, like, what next? Like, biomarker screening results have the same problem as a preventive care visit with your doctor. It's like what happens between the results that matters. It's what happens in those, like, everyday decisions based on that, that cholesterol reading that you had now 3 months ago. That's not the thing you're thinking about when you go into the cafe and make that little choice about, like, do I choose the bacon or the broccoli, right? It's not the thing that you're thinking about in the grocery store when you make the choice between the Twinkie and the tomato. Zipongo was trying to chase down this same tiger, right? They had the same tiger by the tail. It was like how, in the transition from grocery store shopping in which advertisements win. The whole middle of the grocery store where we walk into the grocery store, it's an ad experience, right? You're being advertised to constantly, and all the decisions are being dictated that you make in that grocery store, for example, are being dictated by the ads that you see based on shelf space that's been purchased and things like that. Zipongo is working on making that transition to an online sort of food recommendation experience that allows you to make more conscious choices about what you're eating based on your biomarker data, based on food frequency information that you give Zipongo, and based on your shopping history. That was an exciting prospect to us. It complemented our biomarker screening investments that we had made. It also complemented the major investments that we make in food service at work.
Thank you. Extending upon that, there's a lot of technologies that are kind of coming to bear in a lot of different sectors. And you have an interesting purview at the partnership because you work with grocery stores and you work with CPG companies, a lot of different players in the food space. So how are you seeing different companies leverage technology, and kind of building on what Esther was talking about with Hiccup, what are you seeing in terms of technologies and programs that are starting to work at the community level?
Yeah, I mean, well, so stepping back a little bit, there's a lot going on in this space, and it's all great, and it's because the companies are seeing the future, and they're facing a demand for healthier options. I mean, Walmart doesn't make these significant changes unless they see that their customers are requesting it, and I think what that's going to lead to, and what that is leading to, is basically everyone in the food industry trying to get around and figure this out so that they can be profitable, sell their products, and do it in a more healthful way. So some of the things are fairly low tech, and it's portion size, it's pushing diet drinks versus regular drinks. It's old-fashioned things like pushing frozen vegetables if you can't get fresh vegetables, or canned vegetables if fresh vegetables aren't available or in addition to. Those are a lot of the things that we're seeing. In the technology sense, one of the examples, some of you may have seen the McDonald's last year made some changes in their Happy Meal. And as part of their menu reformulation, one of the things that they did was they reduced the calories in their fat-free chocolate milk to, I think, about 130 calories. And there are some chocolate milks on the market that are well over 200 calories. And I talked to them, and they told me that the reviews that they were getting from the chocolate milk were out of this world. And so you're seeing a lot of effort in both sort of new school technology and kind of old style technology that is, I think, all going to come together and make these changes. The first deal that we did back in 2010 was with a coalition of 12 large food makers who agreed to reduce 1.5 trillion calories out of the food that they sell over a 5-year period. And they just reported on their initial results, and after 3 years, they reduced calories by 3 trillion. And so it's just a sign that no one of these sort of changes is going to solve this problem. But when you take into account all the different things that are happening kind of on the private sector, combined with all the things that are happening with the public awareness and families thinking about this, plus the changes that we're seeing in public policy and regulatory, altogether, that's, I think, what's making these changes possible.
Yeah, agreed. Thank you. And I don't know if people follow some of the literature in the news about child obesity, but recently they've shown in New York City and in Philadelphia that there's been a decline in child obesity, which is pretty awesome. And it really is a testament to the work of CDC and Let's Move and the partnership and these individual programs and technologies that are coming to bear. And Esther and Hiccup will be measuring to see which ones are really working, can take it out to all the other communities. So Aaron, a big topic in employee wellness and the health insurance space is this question of ROI as it relates to wellness programs. And wellness programs kind of get a bad rap because there was a RAND study recently that gets misquoted and misinterpreted by a lot of people as saying wellness doesn't work. What it really said was wellness really works. It actually, in 5 years, has a huge return. You can see changes in behavior from investing in programs, and you can change health outcomes. The problem is that if you look at the entirety of employee wellness, not all companies are implementing it well enough. And so when you mix all of them together, you don't get a statistically significant result. So how are you going about looking at this at Google so you can measure the different components of ROI? And then what are the aspects of programs like Zipongo that are providing value to a company like Google that makes it worth paying for?
So totally agree with your points about the RAND study. I think that Google, I think that, first of all, data is a very important piece of this. And the way that you collect that data and that you have systems in place to collect that data is extremely important as well. There's a juxtaposition between health data and technology data, right? And that's an interesting, it plays out, that dynamic is tricky at a place like Google, and it's a tricky thing that all of us face working at that intersection between health and technology. Data and technology moves at one pace. The data collection systems we have for individuals' health moves at a much slower pace, so we needed, part of the reason that we're sort of being very measured about the way we step into a program like the Accelerator and not just sort of, expanding the portfolio quickly, is to make sure that we have the systems in place within the company to measure change. And primarily those are focused on behavior change right now. We'd like to go as far upstream in the disease process as we can and make measurable differences there. And we believe that that will play out over the next 5 years and 10 years.
Great, thank you. Larry, how do you think that people in Silicon Valley, investors, entrepreneurs, can interact with the Partnership for Healthy America, with the partnerships that you've made, where people have stepped up and said they want to make change, but they need help, and also around policy and government? And how can you help facilitate that, your organization?
Yeah, well, a couple of things come to mind. So first, I think what's great about the people in this room is that everyone wants to do well here. They want to do good, I should say, here, and make a difference. And I think in the space that we're talking about in health and wellness and being part of the mission to solve childhood obesity, we're on our way to doing that. And we need everyone's help, though, to make it kind of over the finish line. Number two, people want to do well and be successful, and investors want to get return on their money. And I think we're demonstrating that big businesses are seeing the future, and many of the ideas that I've seen just listening and meeting people here are obviously going down that road as well. So I think we can do well and we can do good. What we are trying to do is provide a kind of neutral, convening opportunity for funders, whether it's foundations or venture capital, big business, and entrepreneurs and others who are at startups and nonprofits, as a place to come together and work together to make deals and allow things to really move forward. And Jason, I know you were at our summit last March, and what was great was not the deals we were announcing, those were great, but it was the deals that we were seeing that were happening in the audience between people under this sort of umbrella. And so we now have one opportunity to do that, and we're going to hopefully be building out more opportunities to take advantage of that.
Great, thanks, Larry. And for all of you that are working on something related to child obesity, nutrition, health, I definitely encourage you to kind of break out of the Silicon Valley bubble, as amazing as it is, and really spend some time in DC too, because it's a longer-term effort, but it's an important investment if you're building a company that's meant to last. And the PHA Summit is a great way to engage with people. So a last question for Aaron, then I want to open it up to questions so you guys can get to lunch. Google is sometimes thought of as so innovative that does it even mean anything for other companies? Last year, Vinod Khosla talked about 80% of doctors not actually potentially being relevant anymore because of technology, which is fairly provocative. No one will quote me because I'm not Vinod Khosla, but I will say that perhaps 50% of drugs that are used for diseases like prediabetes and prehypertension might also go away because we actually get really good at prescribing healthy lifestyles that are personalized. What do you think Google can teach from your experiences to other companies and the country about how to do this right?
So I think an important distinction is Google and the products that we build and the interests that we have as a company in the sort of external facing products versus Google as a, running as a self-insured employer. I think we have many of the same issues as other large companies in taking care of people's health and making that really an asset for our company. And so I think we're very closely aligned in those areas, and I expect to see over the next few years more and more other companies of similar size to Google really thinking through how to do things like make biomarker screening relevant in your everyday life, make it very personal, and give you personalized recommendations to help you make those sorts of everyday choices. And the things that we're talking about, while potentially seen as innovative, in the public health world are things that we have great evidence behind to be true. So I don't see, while we may be a little bit out in front and able to have the flexibility to say, we're going to build a different, more longer-term model for ROI, I think we're thinking about the exact same issues, and I'd love to be partnering with other companies to build coalitions around some of these issues.
Thanks. Let thy food be thy medicine. Enjoy lunch.